Your doctor has prescribed a blood thinning drug called warfarin, or Coumadin. You probably have lots of questions. Well, sit back and relax, as over the next few minutes we will attempt to address some of your concerns and answer many of the questions you may have about this medication. We will also introduce you into a strategy for incorporating your blood thinner medication into your daily life. Perhaps you have been wondering what this medication does and why do you need to take it. Some of the most common reasons for starting warfarin are an abnormal heart rhythm called arterial fibrillation, heart attack, stroke, deep vein thrombosis or DVT, pulmonary embolism or PE, or because you've had recent surgery and you're at risk for developing a blood clot. So, how long do I need to stay on warfarin? Well, the answer is it depends. In some cases, warfarin is prescribed for just a month to prevent blood clots. In other cases, it might be used for the rest of your life. Your doctor can explain to you how long you need to be treated. Because blood thinner medicine keeps your blood from clotting, it also increases your chance that you could bleed too much. So, if you're using this drug, it's important that you be careful in your daily activities. You do not need to avoid general activities of daily living, but you might need to be careful when doing activities that might put you at risk of injury. Avoid high-risk contact sports and other potentially dangerous activities. However, you can still enjoy many of the same activities you enjoyed before taking your blood thinner pills. You just need to be a little more cautious. Don't be afraid to discuss your concerns and ask questions of your physician, pharmacist, or nurse. Determining the right amount of warfarin prescribed to you is based on a couple factors. It's also determined by genetics, diet, and other medication. So your prescriber needs to determine the proper amount. For this reason, you will need to be scheduling regular blood tests to be sure that you're not getting too much or too little of the medication. You may have been referred to the anticoagulation clinic here at Samaritan Health Services. In this case, you will be asked to come in for a fingerstick blood test to assess your treatment. The visit only takes about 15 minutes, and this can be scheduled in Corvallis, Albany, Lebanon, Sweet Home, Lincoln City, or Newport. Alternatively, your doctor might be the one to monitor your therapy at his or her office, or you may be scheduled at the Coumadin clinic at the Corvallis Clinic. If you're set up with a home health nurse, your treatment will be managed by phone. The nurse will draw your blood, and somebody will call you with dosing instructions. If you're going to a nursing home for rehabilitation, the staff at the Anticoagulation clinic will help manage your treatment by phone, or they may come and see you at the nursing facility to review your treatment. In any case, it is important for you to follow the instructions of blood testing on a regular basis. The blood test, called an INR, lets the anticoagulation clinic or doctor know how much medicine you need. The INR will tell us the amount of time it takes for your blood to clot and whether or not he or she might need to adjust the dosage you are taking. If your INR is too high or too low, your dose of warfarin will be changed until your INR is within the range that is right for you. It is very important for you to have your blood checked as often as your clinician tells you to. It is the only way he or she can tell how much medicine you need and to minimize your chances of clots or bleeding complications. If you get scheduled for any invasive procedure, surgeries, or dental work, your care provider will decide whether you need to stop your blood thinners or not, and he or she will give you instructions on what to do. Never stop your warfarin without talking to your anticoagulation clinic provider or physician. Like most medicines, warfarin can have side effects. Some of these may include bruising easily, or having your gums bleed from brushing your teeth. If you find any unusual bleeding, like dark tarry stool, nosebleeds that won't stop, and coughing up blood, let your clinician know right away. You should try to be careful in your daily activities and avoid injury as much as possible. If by chance you do injure yourself, whether it be from a fall or a hard bump to the head, you may need to see a provider to get checked out. And if you're not sure, it is always better to call and get checked out. Even if you have a busy life, that should not stop you from following a regular schedule to take your medicine. There are many things you can do to remind yourself to take the pill at the same time each and every day. You can also get family and friends to help remind you until it becomes a habit for you. Either way, it is important for you to remember to take your medication exactly as your doctor prescribed. Usually, your provider will ask you to take your warfarin either during dinner time or at bedtime. We do this so that your provider can get your blood test results before you have taken the dose for the day, which might be important if you need to change your dosage. If evenings are too hard for you to remember, please talk to your anticoagulation pharmacist, nurse, or physician about your schedule. For your own safety, you should also consider wearing a medical alert bracelet or carrying a wallet card as a way to let others know that you are on blood thinner medication in case you can't. The food and drinks that you consume can also affect how well your blood thinner pills work. You want to be consistent about the things you eat or drink that are high in vitamin K because it can affect the way warfarin works. Vitamin K is found in most green leafy vegetables, but also in other kinds of foods such as mayonnaise. The most important thing to remember is to keep your diet consistent. We don't need you to avoid any of these foods. You just want to be consistent about the way you eat them, which means if you like to eat salad every couple times a week, you can do so as long as you do it consistently. You don't need to avoid any of these foods. You just want to be consistent about the way you eat them. What this means is, if you like to eat a salad a couple times a week, you can, just as long as you do it consistently. What we want to avoid is having you, for example, eat a salad every day this week and then none all next week. These kinds of dietary changes will require that your warfarin dose be adjusted. Please note that it is actually easier to regulate your blood if you do not avoid salads and the green vegetables, and we encourage you to eat those for a heart-healthy diet. It is also important not to make any major changes in your diet or start a weight loss program without first consulting the clinician who is monitoring your warfarin. It is important to tell your physician and your anticoagulation clinic about the medications that you are taking or want to take. This includes all medicine that other doctors have prescribed or ones that you might buy over the counter at your neighborhood drugstore or supermarket. If you pick up new medications at the pharmacy, please tell your pharmacist that you're on warfarin or Coumadin and ask him or her if the new medication is okay to have with warfarin. If there is an interaction, please call your anticoagulation clinic pharmacist or nurse or physician before starting the new medication. Your provider can then change the medication to something that might be safer, or your warfarin dose can be adjusted to account for the interaction. Some topical medications will affect warfarin like Bengay, or some yeast medications, so ask your pharmacist before using them. Remember that herbal medications are medications also. So please check with your pharmacist before starting them to ensure that they do not interact with warfarin. It is okay to take a multivitamin containing vitamin K. Just do so on a consistent basis. Talk to your doctor about taking aspirin, as it can further reduce your blood's ability to clot, and you can bleed too much. In some cases, your doctor may decide that you need to be on aspirin in addition to warfarin because of your special medical conditions. Tylenol is usually recommended as the safest option if you need something for headaches or minor aches and pains. If you drink alcohol, it is recommended that you talk to your clinician about your intake of alcoholic beverages. If your physician has approved that you may have some alcohol, an occasional glass of wine with dinner, for example, is not a problem with warfarin. It is not recommended to binge drink, however, because that may cause your blood to get too thin and result in bleeding complications. So to summarize, if you have been prescribed a blood thinner, there are some major points you should try to take away from watching this video. We will now outline these points. There are 4 main points to remember as you undergo blood thinner drug therapy. These are: eat right, stick to a routine when taking your medications, get your blood tested regularly, and direct any questions or concerns to your doctor immediately. By following these guidelines, you will be following the best strategy for taking blood thinners safely. We hope this video helps shed some light on what a blood thinning drug is, what it does, and how it can help you. We have explained why your doctor may have prescribed it, and we have shared a number of things to also keep in mind. Remember that clinicians are always there to answer any questions that you might have about your blood thinner pills. Thanks for watching, and please ask your pharmacist or nurse to clarify any further questions you may have.